Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here is your host, hospice and palliative care leader and educator, Dr.
Hello and
Millicent
welcome to the Quality of Life
Burke-Sinclair.
podcast. I'm here today with John Roberts, who is here to share his journey with Four Seasons as we served his wife, Wendy, in both palliative care and hospice care. And then we were honored to serve him through our grief care. Thank you so much for joining us today, John.
Thank you for having me. Glad to be here.
Well, I'm so grateful that you're taking some time just to share with us. And I want to encourage each of our listeners to really take some time and think about what John shares today, because whether you've been in a similar role or whether you may be in years to come, it's really meaningful that John is sharing his story today. So thank you so much.
It's my pleasure. I'm always glad to talk about Wendy.
Oh, well, thinking about your story with Wendy, could you tell us a little bit about your wife, Wendy, and how you started your journey with Four Seasons?
Certainly. So Wendy had a stroke in August of 2019. And we were living in Apex, North Carolina at the time, right outside of Raleigh. And she was a school teacher, elementary school. And she had a stroke, and it was kind of just out of the blue. Nothing kind of to indicate that anything was going on. And she was back teaching a few weeks later. We assumed, okay, do some therapy, everything will be good. And then about a year and a half went by, and she started having more seizures, more things along those lines, things that were indicating that there was something else going on beside the stroke. And the MRIs and all the tests bore that out, that there was some damage ongoing within the left side of her brain. And we made the decision at that point to pull up our tent stakes from the Wake County area and moved to Henderson County, North Carolina. We moved to Hendersonville, and that was going to be kind of a time for us to just enjoy the time we had left, because we realized that there was a time limit to what was going on, that things were progressing in a way, or declining in a way, that led us and doctors to believe that things were going on that were going to probably come to an end sooner rather than later. So we had gone to see her primary care doctor one day, and her doctor recommended palliative care. So I thought, okay, I have no idea what that is. I got my phone out while she was out of the room, and I was Googling palliative care, trying to figure out what that was. And as I was reading it, I was intrigued, because I liked the concept of not having to get Wendy out to a doctor's office, to do things that could be done in home. Because at that point, she was a lot more skittish. She was a lot more anxious in traffic, a lot more anxious going places, and just wanted to find a way to make that process easier for her, while at the same time, through the palliative care, giving her an opportunity to get top-notch care, having someone to keep an eye on things, whether it's medication, life habits, the things you need to know as a first-time caregiver, all those things that Four Seasons Palliative Care offers that I had no idea was even an option. We made a phone call. They came out, did an evaluation, and said she is a perfect candidate for palliative care. So we started in October of 2023. We had a lovely palliative care nurse named Nicole, who came out once a month and did all the tests that the doctor would usually do, checked blood pressure, checked temperature, checked her medicines. That was one nice thing, is that if something needed to be altered medicine-wise, she could put in a referral through Four Seasons, and they could get that filled, which was a really nice thing when you're caregiving, to not have to go through several hoops when a single hoop was sufficient. So we started in October, and to start, it was outstanding. Nicole was great with Wendy. She was great with looking at what she needed, looking at what she could handle, and just putting a plan of care around her to where I felt like she was getting the best care she could possibly get. And at the same time, not having to go out and about and be in places where she would get nervous or anxious or anything else. So it was a real benefit for both of us. And one thing I guess that a lot of people may not know about palliative care is it focuses obviously on the patient, but it also focuses on those around the patient, the caregiver, family members, about making sure that they've got the tools and the techniques, I guess, for lack of a better word, to make caregiving a little bit easier. I'm not going to say it's a whole lot easier, because it's still caregiving, but there's just things that they know that I didn't know. There's ways to do things that I'd never done that before. So for me, it was all new. So that gave me the confidence to be a better caregiver for Wendy, to realize that I could do this. What I needed was some information and just some tips to make it a little bit easier for me overall every day. So that was kind of our experience with palliative care. Nicole would come once a month, and we'd have discussions about where Wendy was. She wanted to know how I was doing, which was a great thing. She was always recommending getting more rest and making sure I was eating right and exercise, all those things that kind of get pushed to the back burner as a caregiver. She was also very supportive, very, very encouraging, and as far as letting me know that I could do this, even as Wendy's condition worsened to where she couldn't walk and she couldn't talk and she couldn't feed herself. That encouragement led me know that I could keep her at home as long as possible, which I think at the end of the day, most of us, if not all of us, want to do for a loved one. We don't want to have them have to go somewhere short of needing to go somewhere, and that happens a lot, of course. But to have the ability to take care of Wendy at home with resources that, quite honestly, I'd have paid a whole lot of money to have these kind of resources, and to have them available and be able to use them and kind of benefit from them was a real blessing. Everybody who asks me about palliative care, I just say, hey, if you think you need it, you probably need it. And the process is relatively easy to get started. It's just a matter of just admitting that you need help, admitting that that's okay, that's as sometimes we don't want to admit that we need help. But palliative care is a great step just to say, okay, this is just assistance. This is somebody to say, hey, her vitals look good, her meds look good. They'll check for skin issues, which are always an issue when you're talking about somebody who's in that state. For me personally, without that palliative care, and it was only for about 6 months, but without it, I'd have been lost. That last 6 months would have been much more difficult, and it was still pretty difficult. But Nicole was wonderful through that time as Wendy started to decline to where we really needed help. As she transferred to hospital care, there was also palliative care there as well through Four Seasons, which is nice to have. Hospitals can be kind of scary and stuff, especially with a loved one. But we had a palliative care nurse at Party named Natalie, who was equally wonderful, just did a great job and was a great liaison between me and the hospital staff and doctors and everything. And sometimes that makes a difference. I mean, we might as well be honest. Hospitals are busy places and things can, we'd always like to see things happen faster. But having a palliative care nurse at the hospital as well kind of made that transition a little bit easier to where things were happening. And it made me feel good to know that she already knew all about Wendy's case. It wasn't a situation where we had to backtrack and describe that. She had all the notes from Nicole, so she knew where we were and what we were up against. When you're talking about somebody at the end of their life and you have hospital stay, something like that can make a big difference and just alleviate fears and anxiety over care and things like that for your loved one.
Thank you for sharing that. So much of what you said made me think about our commitment to providing compassionate care. And we define compassion as we care for all. And when you think about we care for all, it's wherever they call home, at whatever stage they're in, and whatever season of life they're in. And I can only imagine how challenging it was for you as both the husband and caregiver. And a lot of people listening may say, I've been there, and it is incredibly difficult. But something that you described all throughout your talking today made me think about the word comfort. And we want to ensure that people are comfortable. And some ways that we ensure that they're comfortable, you shared. But oftentimes, it starts with us just listening to say, what do you, as the spouse, as the caregiver, as whatever the relationship may be, what do you need? And I believe that you shared something really important, that you had questions, and palliative care team was able to answer those questions for you, give you some additional things to even consider, and ultimately come alongside of you and your wife. When I think about the care teams, whether it's social workers, nurses, nurse practitioners, physician assistants, physicians, whomever might be in the palliative team, and I could have left some out, not intentionally, but they're all coming alongside that patient and family to say, what's most important? And what would your response be to that question at that time? What was most important to you?
I would say the most important thing to me at that time was just having a plan. Just having a plan to where we knew everybody was on the same page. I think that's what, to me, that palliative care does, is it gets everybody on the same page. It's hard sometimes when you're talking about different offices or hospitals to get everybody on the same page. Wendy even had a stint in rehab at a local rehab facility, and we had a palliative care nurse there as well. So everybody knew what was going on. Everybody knew her when they saw her. It wasn't as though I had to go back and retell the story, retell what was going on. They all knew. They all knew what was going on. They all knew where she was in the treatment plan that they kind of got together for her. So we knew kind of where we were. And I think most people who are dealing with that's what they want. They just want to know that someone cares, and they want to know that there's a plan. I think, and it's hard when you're dealing with that, and you're the caregiver. It's hard because it's almost like you're in survival mode all the time. Everything's survival mode. So to have people like Nicole Nicole and Natalie. I think Cassie was our nurse over at the Laurels. It just made that process a whole lot easier, because while all this is going on, she's declining. So it's, you're trying to spend as much time with her as possible, knowing that things are moving in a way that probably there's not going to be a whole lot of time left. And have spent time, reiterating and going back through things again and again with different doctors or whomever would have been difficult. In this case, I didn't have to do that. They all knew. They all pulled it up on their laptop and said, okay, and we're reading through it, and they knew what was going on. And that's, for someone who's kind of doing this by themselves, it's a great asset. It really is. And as her condition worsened, another thing that I didn't really think about palliative care being involved with, but which palliative care was involved with, was having that discussion about when the time was right to transition away from palliative care. That they had Wendy was in a condition where things were not going to improve, and that we had to think about, which is not easy, think about the end of journeys, end of life, if you will. So when Wendy was readmitted back to the hospital for the last time, Natalie came by one afternoon and pulled up a chair and said, we need to have a talk. And I said, are we going to have that talk? And she said, we're probably going to have that talk. And we spent a few hours just going through all the aspects of what that looks like, which is, she's not going to get better. She's not going to, her body is probably doing us a great favor by saying, I'm tired, I can't do anymore. And that's kind of bittersweet. I mean, you don't want to hear that, but at the end of the day, she didn't want to suffer, and I didn't want her to suffer either. I didn't want her to have to go through things that were just going to prolong the inevitable. And that's not always easy to say when it's your soulmate and your best girl. But at the end of the day, we had that conversation, and we talked about what the next steps looked like. We talked about Elizabeth House. We talked about hospice care. We talked about how we got from A to B. And when she left that day, we had a big hug and another cry, and just decided that we had made the right decision. Everything was where it needed to be. Her body was letting us know it was time. And so that was on a Friday afternoon. I think on that Monday morning they showed up, and we actually made the little short trip from Pardee to Elizabeth House. All obviously was handled through Four Seasons. I didn't have to. I basically just was there, just signing a few papers and just trying not to break down every 5 or 10 minutes. But at the end of the day, even with all that going on, there was still a certain amount of peace involved, because I felt like we had done everything we could do for Wendy. And now we were helping her have this last chapter in a way that not only gave us peace and comfort, of us being me and my family, Wendy's family, but also gave her peace and comfort. I like to think that in her mind, as bad as it may have been at that time, she still was thinking, hey, this is what I need. And I think she'd fought long enough, and I think she was at a point where she knew this is what was going on, and she wanted to be in a place where she could just kind of let that last chapter, let that be a chapter that we all remembered more down the road in a positive way than a negative way, if that makes sense. To where you're thinking, this was a really bad situation. This was the end of someone's life, but it was also quiet. It was also comforting. It was also peaceful. It was also handled in a way with dignity, to where she got to kind of be in charge one more time, which I think is, if you think about it, don't we all really want that at the end of the day? If we have that chance to say, hey, I got to go out on my own terms. I hate to Frank Sinatra it here, but we kind of did it our way, in a way of speaking. So that Monday, not to digress too much, we made the trip to Elizabeth House, and I had no idea, again, what to expect at all. Hospice care always seemed very, you don't think about it in your 50s, but at the end of the day, that decision was probably one of the best decisions I made in the last 6 or 8 months Wendy was alive, because it gave me a chance to be her husband again. It gave me a chance to just spend time with her, to not have to worry about the caregiving aspect, to just be there. I mean, just from the time I walked in the door at Elizabeth House, we were greeted with care and compassion, and people who obviously that was not their first trip to the rodeo. They knew what was going on. They knew what people were feeling. They knew how they may have been dealing with various emotions, whether it be anger or sadness or despair, whatever it may have been, and they had a real grasp for that. It just made that process easy for me, because it was still, I was still crying about every 30 minutes, so trying to figure it all out. But once we got there and met her care team, which there was a whole bunch of people, doctors and social workers and nurses, and just a myriad of people, all with the same goal, which was to make her stay, as ever how long that ended up being, whatever ended up being, to make that stay the best possible experience for her to see the end of this life out. And that can be hard, that can be difficult, but at the same time, we always talked about, as her condition worsened, we always talked about, what does this look like to you? What do you envision your last chapter look like? And she was always like, I want it to be peaceful. I want it to be quiet. I want to be able to just see the end until the end. And at Elizabeth House, I couldn't have asked for a better experience. Everything from the people to the environment to, be able to have people come and go and people come by and see her and visit with her. It was just, I hate to say amazing because I think we overuse that word a lot in our society, but it was at that time to me with what I was going through, it was pretty amazing.
That makes me think, as you were sharing, how you said it was important to you when she was being served in palliative care that you felt like you were supported with a plan. And then as you talked about how her diagnosis and symptoms progressed further and hospice became appropriate, that it was also important that not only was that plan one that was supported and honored, but that you felt peace in the process. And certainly you wanted that for her. And is there anything else that you would like to say? That confidence level is what we affirm for all the community, is that when we make a decision to hire someone into a role, for example, to be a CNA or a chaplain or whatever the role may be, we really spend time getting to know their heart, their passion. Why do they want to work in the space of hospice and palliative care or home care, care navigation, grief services? And when we can connect that why and then support them with excellent training, we can be pretty confident in the care they're going to be able to provide. But hearing about it from someone who's gone through it, and you say, you know what, they gave us confidence, they cared with compassion, they cared about you as well as your wife, they came alongside of you and answered your questions and gave you more to think about, that means a lot. I wonder if there's anything else that comes to your mind when you think about the experience with hospice that was key, even with your own journey, as your wife did make a transition. She transitioned from palliative into hospice, and then those final days. Could you share a little bit about maybe some of the support that came alongside you or continued to be with you, even in those final days and after?
Sure. Yeah. We could sit here for a few hours and talk about the experiences from Elizabeth House. Just a few that kind of come to mind for me personally was obviously the staff. The staff was amazing. From nurses to CNAs to doctors to social workers to chaplains to housekeeping. They were all amazing. You could tell that they all had a heart for what they were doing. There wasn't a job to them. This is what they felt called to do, and you could tell because they were all really, really good at it. Yes. It was palpable. You could feel it everywhere you went. And whether it was just letting you have space, it wasn't, the hospital can be a place where we're always coming and going and everything else. Elizabeth House with hospice care, things are a little bit calmer. If you're having a moment and you're spending time with your wife, they won't come in and bother you. They'll wait and come back in a few minutes or whenever the time is right to do whatever they need to do. Getting to know people who were in the same situation. That was something I hadn't really thought about, but met some folks who had family members in hospice care at the same time, and just, you have that there's a real family feel there between people who are all going through the same thing. Because at the end of the day, regardless of what they're going through, you're still in hospice care. So something traumatic is about to happen or something life-changing, and to be able to talk to people who are in that same position and just have open and honest discussions about the way you're feeling is a real benefit. You don't think about it at the time, but looking back on it now on the grief part of my journey, it made a big difference. But for me, if I had to encapsulate the Elizabeth House experience in one story, Wendy went to Elizabeth House on Monday at about 9:00, and she passed away that Sunday night at about 10:30. On that Saturday afternoon before she passed away, it was probably about 2:00, her CNA came through and said, "Hey, I'm going to give Wendy a bath today. Would you like to stay and help me?" Which to me was great. I love doing that. So I said, sure. So it was about 2 hours. By the time we finished, Wendy was good and clean, ready to go. We were both in tears, the CNA and I, because we had talked about, she wanted to know all about Wendy. And then that brought up some things that she was dealing with in her life, gave us a chance to kind of talk about those things together, which to me is the ultimate mark of real compassion, is people sharing what's going on, so that, that you realize that as bad as the situation is, there's a lot of people suffering just as bad bad, if not worse. And for someone who's grieving, just that little thing. I mean, it's a simple thing. It's a basin of warm water, and it's like some towels and some soap. But to spend time just serving somebody else was amazing. We'll do that for her. And then I realized that this CNA was doing it for us. And I thought, wow. And I thought, who does the hiring at Four Seasons? Because they are amazing. They definitely do a good job getting just the right people, because this CNA, and unfortunately the name, I'm just terrible with names these days. So, but at the end of the day, she was so warm and so compassionate and had such a heart for what she was doing that it made me feel, I hate to say good, but it made me feel really content about what was going on, knowing that we were getting close and everything else. And just to know that I wasn't alone, Wendy wasn't alone, that there was a place that you can go to just have that last chapter. Like I said, that last chapter be something that you kind of have some control over, that you can have that peace in that comfort in an environment that, quite honestly, it's hard to replicate that. I don't know. We're very fortunate to be in an area this size and have something as special as Elizabeth House, because a lot of places don't. And it's a real blessing, to be honest with you.
Thank you so much for sharing that. I tell you, it makes me think of another question for you, which shifts just a little bit, but could you talk to me a little bit and share with the listeners about the impact that grief services has had with you? And then perhaps connect it to, you decided that you want to volunteer and that you want to give back because of the experience that you had in your heart with helping others. So could you talk about how grief support and volunteering may be so key for you?
Yeah. So Wendy passed away on a Sunday, and her funeral was the following Friday. So that week was kind of a blur. But I had reached out to the chaplain at Elizabeth House, and she said, hey, in a few months, once you get to a point where you're able to go through some grief services, someone will be in contact with you through Four Seasons, and we'll just set up a time to get together and talk about what's available. So it was about 2 months later, I heard from Jessica with Grief Services, and we had a nice phone conversation, and she said, there's a class that's getting ready to start in a month. Would you like to come and join up? It'll be about 6 weeks, and we're just gonna come and talk about how we're feeling. There'll be a lot of tissues and a lot of crying, and that sounded good to me, because in my life at that point there was a lot of tissues and a lot of crying. So I felt like I was ready to move forward and to just see what a grief journey looked like. Having never been on a grief journey, I wasn't exactly sure what that looked like. I knew I felt sad. I knew I was tired, just trying to get back on track. But in talking to Jessica, she was very encouraging and said, hey, this will help. I really think you're in a good place where this is going to help. So started that in May of 2024, and as predicted, the first class, lots of tearing, lots of crying. Didn't say a whole lot. I was just kind of there, but fortunately the other 8 or 10 or 12 people in the class were picking up the slack for me, because I was still dealing with a lot. But over the course of those 6 weeks, and dealing with people who were, and working with people who were dealing with the same thing, I found that I wasn't alone. I found that there were people out there dealing with the same thing I was dealing with. And for somebody who loses a spouse, especially in our case, we didn't have any kids and nothing like that. So a lot of the time I was by myself. But to have a group that was there, that you could go and just talk about how you were feeling, talk about how you didn't like 7:30 at night anymore, and talk about, what do you do when you get up in the morning and it's 9 o'clock and you've gotten everything done because you're so used to caregiving all day. And Jessica was really good, very gentle, very kind spirit about this is everybody's individual here. There's no grief journey like 101. Everybody's going to have a different experience and a different journey, so to speak. Some could be 6 months, 12 months, some could be years. You don't know until you get started. And the nice thing about grief services through Four Seasons is that there's not a set plan or anything. You just go and just get involved. Go and share your story, share and listen to other stories, and then at that point you decide how much or how little care you really need. Some people can hit the ground running and it's they can kind of move along faster. Some people don't. I kind of was in the middle. So having that 6-week class kind of got me going to a point where I was like, okay, whenever the other offerings come out, I think I'll do that. So that she had a poetry club. I signed up for the Grief Poetry Club. Never knew that was a thing, grief poetry, but I found that there was a thing, and it was actually very helpful. And we had some grief book clubs where we read about different grief books and talked about different aspects of grief from different cultures, different countries, just comparing grief and what people go through. And it was very helpful. And I was beginning to realize this is probably the fall of 2024. started to realize that I was starting to make some pretty good progress. And I was like, wow, this really, the grief services was, I had set the bar low because I wasn't sure just what I could handle grief services wise, but Four Seasons really got me moving and really got me to a point where I could handle life without getting upset, that it was okay to get upset, but it was also okay to have a laugh and to do all that. And grief services does that as well. It was interesting that you could go to a grief group and people would say, what kind of group are y'all in? I'm like, well, it's a grief group. You guys were laughing over there. I was trying to wonder what was going on. I said, yeah. I said, it's interesting how when you bring up things like grief, if everybody's on the same page, you can have a laugh and it is okay. And so at that point, I began to realize that while I was looking for some ways to volunteer in Hendersonville, I began to think, well, maybe Four Seasons is a place that I could get a chance to volunteer and kind of give back some of what I gained last year. So just talked to Jessica, talked to folks with the Four Seasons Foundation, and found out there was a myriad of ways to volunteer. There's almost so many that no matter what your strength or skill set is, they've got a volunteer opportunity for you, which I think is really neat because a lot of places don't have that. But here, if there's a way you want to volunteer that fits what you feel comfortable with, they'll find a way to use those gifts. And I think that's great because a lot of places don't have that. So got involved working with the foundation some and doing some volunteer work. And now I don't know where I'd be without it. It's like my second home, I guess. I love to be a part of something that's such a big part of the community. When you tell people where you volunteer, everybody knows. Everybody's either had somebody who's been through hospice or been through palliative care or whatnot. And the ones that haven't, I make sure they know all about it. And as long as they'll listen. And to me, that's kind of the beauty of what Four Seasons does. It's there when you need it. It's one of those things that's very comforting at a time when you really need it. But then as you move forward, you realize that even without having a family need for it or a personal need for it, you still want to be involved to help those who do. Because I've walked in Elizabeth House before not knowing what to expect, and to have somebody, a friendly face there, say, "Hey, I've been where you are. It's okay. You're in the right place. You couldn't be in a better place. This is where you want to be, and this is going to give you the peace and the comfort to do what you have to do in a time of life. And it's not all that easy at all. And to me, that's one of the marks of Four Seasons, is that it gives you the strength and it gives you the encouragement to move forward after something that's probably one of the hardest things most people ever have to deal with. So I can't imagine not volunteering. I really am looking forward to doing it even more. So,
as you were talking, it made me think about the word trust. We so often in life look to something to be able to trust. And at Four Seasons, we generally want our community to trust the care that they receive. And as you were talking, it just seemed like the relationships that you were building and that were being built with you brought about trust. And you then decided, hey, I want to be a part of making that possible for others. And Four Seasons started in 1979, and we started from a place of generous people within the community saying, we want to make sure that whoever needs access to care has it, regardless of their ability to pay. And so we started a hospice, and then over the years expanded with palliative care and our other service lines. And I think what's so important that you shared is you shared experience of receiving palliative care for your wife, as well as hospice services at our Elizabeth House. But there may be listeners that say, you know what, I'm not near Elizabeth House, but I want this care. You certainly can come, but we can come wherever you call home. And so that's the beauty of it. And as you said, there are hospitals that we collaborate with, and there are communities, senior communities that we collaborate with. We just want you to know that you can call Four Seasons and receive support, regardless of where you are in your journey. Either we're able to say, yes, we can provide that care, or we can connect you with those that we can. And so it means so much to me, John, whenever you were sharing about how you wanted to be a part of making care possible. And we're so grateful for your willingness. I mean, you're doing it today because there's people that are going to be driving down the road and listening, or seated and listening, maybe even crying and saying, I just need help and I need hope. And I believe that you shared from your heart that there is a place that has a heart that can offer help and offer hope. We might not be able to change the circumstance, but we can bring care and comfort during the circumstance. And so I just want to say from my heart to yours, thank you. I experienced our hospice services many years ago with a loved one myself. And then there's been others within my family and friends who've experienced it as well. And what I think about, I think of comfort, I think of compassion, and I think about that coming alongside to let you know that you're not alone. And thank you for sharing your story of allowing us to be a part of caring for you and your wife. And then how you wanted to say, hey, I want to pay this forward. I want to be able to be a part of caring for and supporting others. And so throughout all the 14 counties we serve, we're grateful to provide trusted care. And John, I'm grateful for your willingness to be a part of making that possible.
Well, you are more than welcome. And thank you guys for taking my soulmate, my best friend, and just making the last year she was here one that, while I'll always remember it for a lot of reasons, one of the reasons I'll remember it is what Four Seasons did, the various aspects, whether it's palliative or hospice or grief services, and for just giving me a chance to be her husband again. Because I think at the end of the day, what you said about trust is exactly right. And I think that trust is hard earned. And I think for what I've seen since I've been here with regard to our Four Seasons is that trust is well placed. People get that. And I think I felt like it was kind of something I wanted to do, to go out and just make sure everybody knew, hey, this is here. Don't let this pass you by. Don't struggle at the end of a loved one's life when there's resources here that can make, I'm not going to say it's going to be easier, but it might be less hard, which I think at the end of the day, when you're talking about a loved one and a loved one's passing, that's all we can really ask for. So thank you guys for what you do. Please keep up the good work. And I would only say anybody who's thinking about calling Four Seasons, stop thinking, start calling. They can provide a myriad of things to make this process one that is less confusing, less cumbersome, and gives you the peace of knowing that you've done the best thing for your loved one. So thank you guys, and I appreciate the chance today to come by and talk about Wendy. So thank you for that.
Well, thank you so much, John, and thank you to our listeners. And if you're sitting or standing, whatever you're doing right now, and you might say, I need to call now, do it. Just call us, because we genuinely care. We just want to say, how can we help you? What's most important to you? Know today that you are not alone, that we are here for you, and we are very grateful to hear from you. So just give us a call. Thank you.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.